Thank you to our witnesses for being here. You're on the front lines, and your perspective is very, very helpful to us. I have had an opportunity now for several years to meet with some of the workers on the front line and in Wisconsin, as well as families impacted by the opioid epidemic. And the lion's share of work is done on the ground. But I recently introduced a bill, Governor Hogan, I understand you referenced it earlier before I arrived, that would increase and extend funding for the state-targeted response opioid grant that we included in the 21st Century Cures Act. And this funding expires at the end of this year. So we have to act to maintain it. My bill would also give states flexibility to use some of the funding for other substance abuse issues, such as methamphetamine. In Wisconsin, meth abuse has drastically increased by more than 300% in parts of our state, while we continue to see a record number of fentanyl deaths and heroin deaths in other parts of the state, particularly, it's almost a eastern part of the state, western part of the state division if you travel around and listen to what people are struggling with. So this is further straining our local resources and forcing our leaders to look for other ways to adapt to this crisis. Governor Hogan, how would you, additional funding and that sort of flexibility through the Cures Opioid Grant help you in your fight against this ever-evolving epidemic?
Well, thank you, Senator Baldwin. It would help tremendously, and I did mention your legislation earlier. I think it needs to get passed, and we need to reauthorize the bill. We can't have it run out. It would be a critical situation if that happened. And I agree with you on creating more flexibility for the states to be able to utilize and focus on the problems that they're having. You just mentioned in your state, and Governor Walker brought this up at the National Governors Association. It surprised me because we don't really have a methamphetamine problem, and we have a fentanyl problem. But most of the other governors were dealing with heroin or other. But a couple of states did mention that this was coming back again, making a comeback. And so I think providing the funding and giving us the flexibility at the state level to use it as we see fit in this critical fight. We need the help. Thank you.
Thank you. I understand that Senator Kane had some questions about foster care earlier. I want to follow on that. The dramatic rise in opioid addiction has proliferated a cycle of trauma that has significantly impacted Wisconsin children. The number of kids in foster care in Wisconsin has grown 20% in the last 5 years, due in large part to parental substance use addiction. The last time we convened for a hearing on the opioid epidemic, I shared with the committee a little bit about, they'd heard me for years talk about the fact that I was raised by my grandparents, but revealing that part of the reason I was raised by my grandparents was my own mother's struggle with addiction due to prescribed narcotics for chronic pain that she suffered throughout her life. I have a bipartisan legislation called the Family-Based Care Services Act, and this focuses on therapeutic foster care. So providing foster care for a child with significant medical or mental health needs. What it would do is help enhance access to services through Medicaid. It provides special training to foster parents and kinship families for youth with major mental health challenges, where children receive in-home clinical trauma-informed services to help keep them in the community. Governor Brown, you note that Oregon's foster care system is similarly struggling with the impacts of childhood trauma from addiction. Can you discuss what your state is doing to address this and why it's important to strengthen federal programs like Medicaid and foster care services to prevent our struggling kids from growing up to be struggling parents?
Thank you, Senator Baldwin, and thank you for your leadership in this arena. We are struggling, our foster care system. We have 1.5 times the children of the national average, and 60% of the children that are in our foster care system, one of their parents is struggling with substance abuse, a good portion of them obviously being opioid abuse. I think more resources is key for us. As you know, intensive, comprehensive foster care programs like the one you just mentioned are extremely expensive. But I will tell you that by investing those dollars at the early age, we will prevent significant expenses to state government in the future. So I applaud your efforts. More resources would be key for us. We are struggling trying to get the appropriate number of caseworkers and the appropriate number of trained foster families to deal with these children's special needs, these trauma impacts that they are seeing from their families. So resources would be absolutely crucial to a state like Oregon.